Hello, everyone. Welcome. My name is Terry Marvin, and I am a board member for Soaring Spirits and the incoming chair for the board of directors. I am thrilled to be here, and it's so exciting to see all of these lovely faces. I can't see everyone, but I know that there are a lot of you out there. This is a very exciting night or evening for Soaring Spirits because you are going to be part of a really big announcement. We are venturing into something very exciting. It's a public health initiative. Michelle is going to talk more about it, but I promise you it's exciting and you're in for a great evening. I need to recognize some other board members who are in attendance. We have Carl Barrett with us.
Hello, everyone.
Debbie Rooney Jaso, our current board chair. Victor Bueno, Greg Roman, and we also have an advisory board member in attendance tonight, and that's Nancy Salzman. So say hello to our board, everyone. Do a little wave. Thank you, thank you, thank you. Okay, and then I also want to acknowledge our staff members who are in attendance tonight. Michelle Neff Hernandez, of course. Angeline Thomas. Wave, everyone. There you go. Mary Moore Hughes. Sade Arillo. Kath McCormick. And last but not least, Susan Hannafin McNabb. So these are the people behind the scenes every day making Soaring Spirits the wonderful organization that it is. And on behalf of the board, I just want to say thank you to them. And thank you to all of you for participating in this really exciting town hall. With that said, I'm going to turn it over to, and Pamela. Pamela Foley is also in attendance tonight. She's part of the staff. So thank you again to the staff, to the board members. And on that note, I'm going to turn it over to Michelle so she can get started to talk about the wonderful, exciting news from Soaring Spirits.
Well, you can call me Miss Nancy from Romper Room because I'm so excited about seeing all your faces. And thank you for telling me who I'm supposed to be because I forgot. I am, for those of you who don't yet know me or have not yet met, I'm Michelle Neff Hernandez. I'm the CEO and founder of Soaring Spirits International. It has been my great privilege to be a part of so many widowed people's lives, and such an honor that they share their stories, their love, their person with us, and their transformation. So I know that is for many of you how you came to us, and I am eternally grateful to be a part of your lives. So I also want to just give a quick shout out to a couple of key volunteers. Lois Tucker Keating is here with us. Rick Malott is here with us, as well as Carolyn Jenkins. They have come on lately as key volunteers who are adding an extra layer of support for our staff. So super grateful to have them here with us tonight. So I want to start with a story. When I was in the earliest stages of my widowhood, and that was right at the time of my husband's death, a very well-meaning chaplain stopped me from going into the room to be with my husband because he felt like that was going to be what was best for me. And at that time, we didn't have very many minutes left. And so the time that I spent arguing with him and advocating for myself to be able to be in the room with him were minutes that I could not get back. And so I believe now that he thought he was doing the very best thing he could do for me, and that in that moment he was trying to take care of me. And I also recognize that I had the capacity and the energy at that moment to advocate for myself. Luckily, there was a nurse who was standing nearby who heard what was going on, and she joined me and advocated with me for my ability to be with my husband. And that was the key that unlocked the door to allow me to do that. And since that time, I've thought a lot about all of the ways that widowed people interact with professionals throughout their widowhood, from the earliest stages, like that story where I began my widowhood, all the way through the financial planners they might have dealt with, the funeral homes, the coroners, any emergency vehicles they might have had a part of the experience of their widowhood, as well as first responders of all kinds. But what many of them have in common is that they are not widowed themselves. And so they don't have firsthand information about the widowed experience. And beyond that, they often are not provided with the basics of grief literacy that would allow them to be able to support a widowed person well. And what that has meant over many, many years is Soaring Spirits hearing a collection of stories of ways in which situations went wrong. And I think of it like this: if the scope is helpful to harmful, right? And harmful is the worst, and helpful is the best. We've heard sort of everything in between, but the dial often leans towards harmful. And that is not intentional. So I want to start by saying that when I acknowledge that it is oftentimes that people interact with widowed people in a way that is more harmful than helpful, I in no way mean that we think that, we're painting everyone with the broad brush. We each, of course, have our personal experiences, and some people have a better ability to sit with those who are grieving than others. However, if each of those individuals, even the ones who have the best heart and who do an amazing job of taking care of widowed people, if they had access to two things: training in basic grief literacy as it relates specifically to the widowed experience, and you paired that with access to resource to be able to connect that widowed person immediately with access to programs that they could literally walk into their house and be able to interact with immediately. Those kind of supports and that level of intervention, especially at the earliest stage of widowhood, what difference might we make for the widowed people who come after us? What experience might you have if each, let's say, the EMT who came to your house, the hospice worker who was sitting with you at the end of your person's life, the doctor who interacted with you shortly after your person died, what if all of them had access to a base grief literacy training, as well as the ability to connect you with resources that mattered, that were custom designed for widowed people? That's the vision for this public health initiative. It's to act as a force for good for widowed people in a new way that allows us to provide that basic grief literacy training, as well as access to resources specifically to a variety of entities that are designed to treat widowhood and widowed people with a new level of compassion and with confidence. Because that's the thing, right? Many times the professionals in our lives, they don't feel confident dealing with widowhood because it isn't their personal experience. They don't want to cause harm. I believe that. They don't want to cause harm. But so often, without that training and without access to resources, somehow the needle leans towards harm rather than help. So what I'd like to do now is pass this on. I also want to acknowledge that this public health initiative came to me in a way like the stars aligning. And it was one of our staff members who called it out. And so I am excited to introduce you to the beautiful and exceptional Mary Moore Hughes. She is our Camp Widow program director and our virtual programs manager. So you can imagine she's very busy. But she brings a wealth of personal experience and professional expertise to her role, with a background spanning 2 decades as a hospice RN and nursing professor. Mary brings invaluable insights and empathy to her work. She holds a Bachelor's of Science in Nursing and a Public Health Nurse Certificate from San Diego State University, as well as a Master's of Science in Nursing Education from Cal State Dominguez Hills. In her time at SDSU, she worked on several public health initiatives in partnership with the San Diego Public Health Department to improve the health outcomes of the homeless population downtown, as well as pregnant teens and their newborns in the downtown area high schools. I would love for you to join me in welcoming Mary, who was the first one to say to me, Michelle, that's a public health initiative.
Thank you, everybody. It's so good to see all of your faces. And thank you, Michelle. Yeah, in general, I just wanted to kind of get down to the basics of what exactly is a public health initiative? How does it look? Why would it be valuable to a community? And how can it benefit a widowed person? And so the formal definition of a public health initiative is a focused and organized effort aimed at improving the health and well-being of a specific population within a community as a whole. So what does that mean exactly from a public health standpoint? You identify a population within a community that has a specific need. Typically, the need is focused on disease prevention and the promotion of healthy behaviors. Those healthy behaviors can be physical, emotional, spiritual. You then would identify an expert or expertise in that area of need. So in this case, soaring spirits, we're the experts. You establish some desired outcomes that you would like to achieve based on the initiative. You then provide education and distribute materials to the community stakeholders, the ones that are going to be really in the community executing these resources that we want widowed people to have early on. They are going to then work collaboratively together to distribute those resources to the identified population. And what's really important is partnerships within that community really help facilitate the pooling of those resources and the efforts that we are looking to help us achieve those desired outcomes. A really key important part of a public health initiative is you look at those desired outcomes and they need continuous monitoring and an evaluation at a specified time to see how effective is this initiative for our community. And you might wonder, so what is a desired outcome exactly? It's really simple. It's just a very specific and measurable goal that is really it's really created to just directly look at the initiative and say, okay, we have achieved looking at the need of that targeted population, and this is how. Because they're very specific and they're measurable, we can see over time how well the resources, in this case, being given early on to widowed people are making a difference in looking at their health behaviors. So how come, you might wonder, how is a public health initiative valuable to a community in general? It can address health-related issues, as I mentioned. It really can engage the community to come together and foster a sense of community involvement and empowerment in trying to help this targeted population. It can enhance the quality of life for not only those individuals, but also for the community as a whole. It can also provide enhanced resilience because it enables the targeted population to have early access to resources that really enhances their ability to cope. And then that even furthermore can have community-wide economic benefits. Particularly, you can reduce healthcare expenses, people have healthier coping mechanisms, people therefore have healthier behaviors. It can also increase the productivity of the residents that live in that community. And so in general, why would this public health initiative make a difference for widowed people? Research rates widowhood, you may have heard this before, but as the most stressful life event that a person can experience. There are a number of factors involved that, as you know, were once shared by two people that now one person has to carry. It might be parenting, household chores, work. You all know all of those factors that you have to sort of manage all on your own, all alongside our grief. And just to be clear and clarify, this is really looking at widowhood as the most stressful life event and not the most profound grief experience. That, is contained within all of our own individual, but it is the most stressful life event. And so when you look at that stress, if you don't have early access to resources, you don't have healthy coping strategies in the community, it can really negatively affect those health outcomes. So we're looking at, again, physical, emotional, and spiritual health outcomes. And lastly, what might be our desired outcomes for the initiative? As Michelle mentioned, we really want to improve that overall health of a widowed person. It typically happens in a selected time frame. We'll be working on that as we continue. We want to make sure that widowed people receive high quality support from the first point of contact at the time of death within their community. And we really want to increase grief literacy within our key community stakeholders, those people who are going to be face-to-face with someone at the time of widowhood. So those are some really important desired outcomes that we hope that this public health initiative can achieve. And with that, I am really pleased to introduce Angeline. She is someone whose journey of resilience and compassion has led her to a vital role in our organization. Angeline is our deputy director, and she joined Soaring Spirits in 2022. She brings with her a wealth of legal, nonprofit, and grief support expertise. In her role as a chaplain at a level 1 trauma center, Angeline stands alongside individuals as they cross the heart-wrenching threshold into widowhood, providing them with compassionate care during their darkest moments. While she finds immense honor in this critical work, Angeline is driven by a deeper passion to create a world where every griever feels understood and supported, which is why she's so excited about this public health initiative. Please join me in welcoming Angeline, who will speak to the difference of having targeted training and resources and what a difference that can make in the hospital setting. Welcome, Angeline.
Thank you. Well, thank you, Mary. And it's so lovely to see all of your faces. I've met many of you, but not all of you. And so I just appreciate you all showing up. So it's my pleasure to actually take off my Soaring Spirits hat for a minute and put on my chaplaincy hat. And so I have a few stories I'd like to share, but before that, I just want to start with some context. So I serve as a per diem spiritual care provider at a level 1 trauma center here locally. We have a 420 bed facility that also serves as the disaster control center for our local county. And we also hold the distinction of being the sole level 1 adult and pediatric trauma center that also has a burn center within our 4-state region. So in this dynamic environment, you might imagine that we see a diverse spectrum of the human experience, including all sorts of profound depths of grief. And my department provides spiritual care 24/7 for all inpatients. So I just like to say, I didn't name the hospital, but I will also just do my little disclaimer that my comments are my own. But I think one of the things that makes that work truly impactful is the fact that grief is universal. It touches every single professional in the hospital. And what varies from professional to professional is the level of grief literacy that we have. And so even though I personally have received excellent training as a chaplain, there's a lot more to learn about the nuances of a particular grief experience, which is why I'm so excited about Soaring Spirits Public Health Initiative. It has the ability to make a really profound difference in the lives of professionals like myself, who would better serve widowed people with training and resources. And so to illustrate this, I'd like to tell 3 quick stories, each highlighting a distinct facet of the initiative's potential impact. So the first story is that long before I knew about the existence of Soaring Spirits, I had the privilege of accompanying a woman from Georgia. Her husband had contracted COVID very early on in the pandemic while working in Washington State. He was here on contract. And tragically, he succumbed to the virus. And so she found herself in a strange place, bidding her final farewell to her beloved through a popper and gloves, far from home. And so as she crossed that threshold into widowhood, all I had to offer was my presence and to stand as a witness to her profound grief. And as chaplains, we're trained that those 2 things are enough. And I believe that they're critical And yet, I believe that my colleagues would want to offer more if we knew resources existed, or at least I know that I did. So in this woman's case, the local resources I had access to weren't relevant to her situation because she didn't live here. And I had no way of knowing how she fared after our encounter. And as a chaplain, this is more often the case than not. Tragic stories like these contribute to compassion fatigue and ultimately burnout. So this story highlights a critical gap in our ability to serve grieving individuals and to take care of ourselves effectively. With Soaring Spirits Public Health Initiative, we have an opportunity to provide a more robust web of support around the widowed person that not only serves them, but also contributes to professional longevity and satisfaction. So I'd like to contrast that story with a more recent experience. A woman tragically lost her life in a kayak accident. This was probably about about a month ago. And her husband was profoundly grieving, as you all can imagine. The difference that happened this time is that I had received specialized training from Soaring Spirits. And I was able to tell the soon-to-be widowed man that help was waiting for him. I was able to educate his family about the resources available. I still offered my presence and witness, only this time I didn't feel helpless. When he left the hospital, I knew that the handoff between the role that I could provide for him as a chaplain and what Soaring Spirits could provide as a peer support network on the outside felt really seamless. I felt confident that he wouldn't have to suffer in isolation for lack of information. And though my heart still broke for his loss, I rested a little easier knowing that he knew help was available. And I'll conclude with just this last story that further illustrates why this public health initiative and what Soaring Spirits training can do to really make a big difference. So in my training, I also thought I knew what a widowed person was. And I think our conventional definition of widowhood shuts many people out of the support that they could otherwise receive. And so on the same night, I met with the widowed person who lost his wife to a kayak accident. On the very same floor down the hall, there was another woman whose longtime boyfriend suffered from a heart attack and was in critical condition. And so by society's definition, no one would have considered her widowed because they weren't married. Many people would probably not have connected her to resources for widowed people. And she herself probably didn't think of herself as a widowed person in that moment. But because of the training I received through Soaring Spirits, I saw her differently and helped her to see herself differently, which then connected her to resources that were available. So she left the hospital knowing where to get help and knowing that if she came to us, that she would belong. So in all of these stories, a common thread emerges. When people don't know what to do, they do the absolute best they know how, for better or for worse. Knowledge empowers us to do better, though. And that's what this public health initiative is about. When professionals are confident in their abilities to navigate the complex terrain of widowhood specifically, they'll serve widowed individuals more effectively while mitigating their own risk of secondary trauma. So our public health initiative is about more than just training. It's really about changing the way that professionals interact with grieving individuals. It's about bridging gaps. It's about increasing the web of support. And it's ultimately about changing the outcome for those who are navigating this challenging journey of widowhood. When we understand widowhood better as a collective, we can do better as a collective. So that's my remarks, but it is my great pleasure to introduce you to Soaring Spirits' newest board member, Carl Barrett. Carl is not only a professional with a remarkable career, but also is a testament to the resilience of the human spirit. Carl serves as a program manager in the planning, design, and construction department at UCLA Health, where he oversees various programs and projects. His role includes managing UCLA's the UCLA Medical Center's art program, handling small construction projects, and triaging new project requests, And in recent times, Carl has taken on a meaningful role within the LGBTQ community, within the health system, leading to his involvement with UCLA Health as the chair of all Pride sponsorships through the greater LA area. I'm delighted to welcome him as an invaluable addition to our board, and he'll take it away. Thanks, Carl.
Hi, thank you, Angeline. It's a pleasure to be here and to be a part of this and to be helping. With what I was going to talk about tonight had to do with about a little bit of the reaction of the professional world, the people that I'm working with inside the hospital. Their remarks there whenever I'm talking about a public health initiative and how we can maybe learn to do our internal job better, how we can help our patients coming in. Because even my own experience, whenever I was inside in the hospital and I'm telling colleagues in the hospital that I was widowed, that, you know, my late partner took his life, and what I went through at the age of 40, what my experience was, you still get some of the, like, I'm sorry, numb, and there's not any response from even our staff who we are in that world, and we are those professionals out there with patients. You know, we're in the hospital to heal and to help people live, and yet we still do go through the sad event of loss as well on a daily basis. So it was really interesting, the responses that I got from staff were like, what if we could do better? What if I can do better and learn something from what you're doing and what your organization is doing? So it was really great to hear the positive feedback. I'm going to be meeting with some more people. We're going to be helping to work maybe possibly with UCLA as well. So that's some of the hope. And then I also want to talk about outside of the hospital, the other agencies that could benefit from this. How, like my own experience from a public health initiative that had reached out to the policemen that were there the night that I experienced my loss, because they had experienced a loss of their own that same night. So none of us knew what to say to each other. They didn't know how to respond to me. They didn't know how to respond to what they were going through, because they had lost someone the same way that I had lost someone that night. And I was very fortunate, eerie way, that I had them there because they understood what I was going through. But had they had this training that what we're working towards giving out to these first responders and to these firemen and these policemen, if they had had this training that we're working towards rolling out to them, how much more could they have done for me that night? And then how much, you know, what a benefit that would have been, and how it would have helped them, I feel. You know, us having the tools as widowed people, when we help another widowed person, we have that tool and we feel like we're able to do something. And they kind of felt helpless, I'm sure. So I'm very pleased to be a part of this and excited to see where we go with it. And with that, I'll turn it back over to Ms. Michelle. Thank you.
As you can see, we are all passionate about this public health initiative in different ways. We come to it through different avenues, and I think that's one of the things I find most exciting about it. But I'd like to give you just a bit of a summary. So you've heard a little bit from various partners in this work, but I'd like you to kind of look at an overview of what we intend. So our purpose is to identify within Simi Valley particularly. So for those of you who do not know, we are headquartered in Simi Valley. We have some unique relationships here in Simi Valley that have allowed us access to decision makers who could determine that they want to be a part of this public health initiative. As you can imagine, that's one of the first roadblocks. How do you convince an entity that they should engage in this public health initiative? And why, as Mary pointed out, why should we pick widowed people? Why wouldn't we just do all grieving people? Why would somebody care specifically about the widowed experience? And my answer to that has been, as Mary noted, if we could start with the most stressful life experience, and again, we're going to say this is not the most profound grief experience. None of us can tell each other what our most profound grief experience will be or has been. And we as an organization are very careful that we're not grief comparing. You all have, any griever knows what that means, that at some point somebody has said, oh, that, you know, your person died, well, you know, my person died, or your someone died and my animal died. And people have had very strong reactions to that, though that animal dying, that was their person. That may have been their person. And for them, that was the most profound loss. So I want to be clear that we are not grief comparing here. What we're doing is taking research which says that the widowed experience is the most stressful experience a person can have in their lifetime. And that's rated on a bunch of factors, right? That's not about specifically grief. It's about the fact that your financial life may be impacted, is very likely impacted one way or another, that your social life is impacted, that your work life is impacted, that where you live is impacted. Literally everything you do in your life is changed when you once had a partner with whom you shared those things. And then when that partner dies and you are shouldering the responsibility for your entire life that you once had together. So that's why we are pointing to organizations and saying, how about we start working on this relationship? What we hope is that they're going to be inspired to include other relationships, to dive deeper into grief literacy. We don't, for the record, believe that we are going to take a public health initiative and completely alter the way, for example, a hospital or a police department or an insurance agency or a coroner's office. We don't think that we're going to provide them with all the grief literacy training they need. That's not the point. The point is to offer them a base level of grief literacy as it relates to the widowed experience, because that's what we do. And that's what we do well. We know how to serve widowed people. We can prove it with our research. We can show that our programs build resilience. And we believe that this public health initiative will also show that early intervention for widowed people leads to better health outcomes, mental, physical, emotional, spiritual, that all of those incomes will be increased. You will have much better incomes than you would for people who struggle year, 2 years, 5 years, 8 years. We have met people who have struggled 22 years, never having met a widowed person that they'd made a connection with. And so we can change that. I feel 100% confident that we can change that. And not only that, but we will be able to show through data that we, using these early intervention models, have changed the outcomes in a particular community. The one we're talking about right now is Simi Valley. So then you might think to yourself, okay, why am I supporting a project that's not in my city and not in my town? As you can imagine, the next step would be determining what we need to know, laying out a plan for a successful launch, being able to evaluate the data to be able to tell people how we changed the community for the better for widowed people, so that we can take that template and move it somewhere else. So the goal is the big dream. What's the big dream is that we are taking this all over the country and all over the world. And I always get a little scared when I say that out loud, because that is, you know how they tell you the big hairy goal, like that's the one you want. That's the big hairy goal, is to have a model that could be used across the country and around the world to make communities more aware of the fact that if we treat widowhood as a community event rather than an individual event, not only is the individual served, but the whole community is served. That's what we're talking about. And right now, I don't know for any of you who are widowed, and I know that not everyone in our audience is. So many of us are grievers of very varying types, and some of us are widowed and grieving additional losses. But one of the things that occurred to me immediately after I was widowed is I felt like I was the only widow in the whole world. And I knew I wasn't. I knew that could not possibly be true, but I felt so isolated in my experience that I did not feel like people could even see me. And it was only compounded by the fact that I was young. People would be, someone once said to me, "No, you're not widowed." "Oh, thank you for letting me know. If you could bring me back my dead husband, I will be certain that I am not widowed." But that, I mean, people had the response because it just didn't compute. And so we can change the way that widowed people enter into widowhood if the community surrounds them rather than steps back from them. If the community feels confident about being able to offer something concrete that will be helpful, rather than trying to pick from the varying phrases that they have heard over the years or thing you say to someone who's experienced a death. And so our opportunity is to take this initiative, do the research and development that's necessary to make sure that it's not only successful, but sustainable and scalable. That's the work. So the big hairy goal, of course, comes with a price tag. We are raising $1 million for research and development. We are beginning that today. Actually, we already began it because many of the people who were at Camp Widow in July started as our early supporters. What's the purpose of that? We have to learn how to do this. I know that many of you have questions right now. By the way, I'm supposed to plug that you should use the Q&A button if you have questions. So if you've put a question in the chat, please replace that question in the Q&A because we can't pull it out of the chat. It's not something we can copy. So please make sure your questions are in the Q&A. But here's the thing. I know you're going to ask me a lot of questions I don't have the answer to. I'm going to have to say this to you. I don't know, and I don't know. And the thing is, any of you who know me well might know that I typically don't like the answer, I don't know. I prefer to be able to know what we're doing and get on with it. So, but I'm feeling really proud of our team for being willing to say we don't know, because that's what the research and development is for, so that we can learn. So for example, what agencies are you going to include? I don't know. Where are we going to start? Which agency is going to go first? I don't know. How many agencies in total will we try to reach out to? I don't know. What would be the next city that we might go to? I don't know. But what I do know is that we can make a difference in this one city. And if we do that well, then we have the opportunity to shape that format over and over and over again for a variety of different sizes. For example, the size of the community is going to matter. So right now we're in Simi Valley. We're at about 130,000 people in our city. What if we go to Los Angeles? That will be a much, much larger place, and we will need to change some things about what we do in order to make that happen. But here's the thing we must absolutely do first, and that is make sure that these programs that we're offering are ready. They're ready for the expansion that's coming. We have reached 4.5-ish million widowed people since our inception in 2008. So 4.5 million-ish people. We've never advertised, not one time. Why not? Because we were afraid of what would happen if we did. We have to be well funded so that we can accept all of the people who might come. And so at 15 years, we are realizing that it is time for us to take what we know and move out into the community with confidence and say to all of you, come with us, come make a difference with us, because we can shape the world in a different way for the widowed people who will come after us. And not just the ones here in Simi Valley, but an exponential opportunity to really be a force for good for widowed people. We're already in the midst of it. So I want to give you two quick examples. We are working with Adventist Health Simi Valley. They are an early adopter of this training opportunity and this resource sharing. And we have trained the whole chaplaincy department. We're moving next to social workers and case managers. We'll also be training their nursing department. And do you know that in the hospital, people are asking, when's our turn? When's our turn? We heard that you're training the chaplains. When are you coming to the nurses? What do you mean the case managers are going next? We want the nurses to be next. People want this training. They want the opportunity to do better for their community and to have the confidence to step out. We are also in the early stages of working with the Simi Valley Police Department. When I went in to meet with the chief, I was expecting a hard sell. I was thinking, okay, here's the thing. I want to know, is there any way that we can make this transition for widowed people better? Because so often it's a struggle, especially for the people who in that circumstance, right, are getting a knock on the door. You know what I didn't realize? That the police department attends every single home death that is not a hospice death. And I hadn't really thought about that. Every death that happens at home that is not attended by hospice has to have a police officer respond, which means that a police sergeant on any given police department might all night long go to death after death after death after death. Now consider how that might impact their mental health. I hadn't really thought about that until we sat down for this meeting, and the community sergeant said to me, I can see why this training would be helpful for the widowed people, but what I would like you to know is that it would be extremely valuable for our officers, because they feel like witness to horrible things over and over again with no opportunity to do anything to help, right? And so what they asked us for was a card that could fit in the pocket of a uniform. so that that officer would literally in their pocket be carrying a piece of a resource in their hand that they could hand out. And so what would we do? Many of you might be thinking, okay, Michelle, do you realize these people are like minutes widowed and you're handing out resources? How's that going to work? We changed the language on our You Are Not Alone cards. We're super excited about it. The new ones are coming soon. Yes, you will be able to order them. We changed our language to acknowledge that in this moment, we cannot take away the pain that you feel. What we can do is let you know that there's help when you're ready. At the bottom of the card, it says, hold on to this card. This offer of help never expires. So what if you got to have that in your hand instead of just an empty hand after everybody has left and you're left to call whomever it is that's going to come and sit with you in that time? So the sergeant, the community sergeant, said to me, this is, yes, for the widowed people, but it's also for the officers, because their mental health is impacted by the fact that they feel like they don't have something that they can do. So these are just two of the entities. So after I spoke to each one of those, both the hospital and the police department, they both raised their hand and said, I know 5 more departments that can use this training. I'm sure that I could connect you with another hospital. And I was like, okay, hold on, because we're not ready yet. We need these programs to be ready for that exponential growth. So I'm excited. You can see why. So those two meetings that I had with the hospital and the police department are what I'd said to Mary when she said, you know, that's a public health initiative. And so that's when the wheels really started turning of, okay, well, who else would we include and how else could we do this? So the other thing that occurs to me that I am just really excited about is the fact that our widowed community is incredible. We have professionals of every kind. We have people who are involved in government. We have people who are involved in a million nonprofits and agencies. And we have therapists, marriage and family therapists. We have social workers. We have medical professionals of all kinds. We have police officers and fire department. We have everything right here in our community. And so making those connections as we get to a place where we're ready to grow this, really, we have the exponential opportunity to make this something bigger and bigger, as long as we take those steps strategically and we don't overgrow. And so that's where we're working right now, in this sort of sweet spot of, let's take these two entities, start here. Let's raise the money that we need for research and development so that we can be very intentional. And then we can go on to determine when we can launch the initiative, which our hope at this point is 2025. So to give you a timeline, we are going to be raising money from now until we get to $1 million and more. Our hope is to begin research and development in 2024. We already have our first element of that planned. And then we will hope to launch officially the public health initiative in 2025. So that will include the opportunity to scale, to make sure that we have all of the team in place that we need, and then to be ready with the various trainings, because obviously different entities are going to need different types of training. So from there, after 2025, we'll be continually, of course, evaluating our outcomes, being able to settle into our data, and then be able to make really strategic plans for the next steps. So like I said, big, hairy dream. It's the big one. What can you do? So I've been asked a million times this question. I'm going to tell you tonight. There's 3 things that are top of mind. You are going to get this in an email. So if you forget it, don't worry about it. It's going to come to you in email as a reminder. The first thing that you can do is make a pledge. If you are able to donate, please do. Anybody who makes a donation of $1,000 or more will have the opportunity to have their person's picture, should they choose it, as well as a dedication on the first public health initiative element. So the first element is scheduled to go out at the end of January. We will have more details on that as we go along, and anyone who makes a contribution of $1,000 or more and wants to have their person's image on the public health initiative will have details for that through Angeline once you make your pledge and donation. So that's an opportunity. You can do that straight on the Soaring Spirits website. We have the public health initiative listed there. And all of, like I said, anything over $1,000 we'll be adding as a dedication. I want to call out 2 amazing people who have already made that contribution. Victor Buono, who is one of our board members, he is making that contribution in memory of his wife, Grace, as well as Paul Hendricks, who made a contribution in honor of his wife, Masha. And we also have more people coming all the time who are working very hard at the Public Health Initiative, including Jenny Armstrong. And Angeline, would you pop for me a couple of those other names? Because I just realized I want to make sure we get everybody. So I'm going to call out some more names in just a minute from the earliest stage from July. So we started in July. We're still moving to our next piece of fundraising, and you'll hear more about this as we go along. So some of you are thinking to yourselves, you know what? I don't have the ability to pledge. I don't have an ability to make a gift right now. Does that mean I can't do anything? Of course not. We have more things to do. One is access your network. If you happen to have somebody in your life who has a family foundation, many times family foundations can direct their funds in whatever way feels like a good mission alignment for them. And that doesn't always match with exactly what it says on their website. So family foundations are a great way. If you have a business, or if you work in a business that allows or that makes corporate contributions and hears from their employees about what they care about, you could advocate for this and make an opportunity for a sponsorship. So those are two of the giving ways. Accessing your network is another way. And the last thing we would ask you to do tonight, actually probably tomorrow, you'll get a survey. And the survey is not your normal survey. It is a survey to determine how in your grief, and anyone can take this, how in your grief you interacted with a variety of professionals. And we're going to use that harmful to helpful scale, right? So 1 to 5 as to how well you felt cared for in that moment. We're going to have all of the people we've already noted, from the earliest stages at hospitals and first responders to financial advisors to insurance agents, all variety of professionals who often interact with widowed people. We want to know, how well did you feel taken care of in their presence? The purpose of this is to help us start to shape, who do we need to train, right? The only way we know who we need to train is if we know how you've interacted with them and what experiences you've had. You're also going to have the choice and the ability to tell a story. So if you have a story like mine, where I had that lost moments from the time that Phil entered the hospital until I was able to be by his side. If you have a story you want to tell, and I want to be clear, you can tell a story where you felt really well cared for, or a story where you felt that you could have been better cared for. Either one of those are welcome. We're collecting antidotes to be able to start to express the value of this public health initiative and why it's necessary. So your stories are going to be the foundation of that. So to recap, 1, you can make a pledge. If you choose to make a pledge and make your donation right away, over $1,000, you will be included in our dedication of the first element of the Public Health Initiative. You can make a donation of any size, though. You know that every dollar matters. That's always true. Second thing is, you can access your network. Ask your people to care about this. Find a sponsorship. Find a family foundation. The third thing is to answer our survey. If you would be willing to answer our survey and help us to collect the data that's necessary for being able to express the value of this, that would be a huge step in the right direction as well. So on that note, I want to check in with Angeline to see if we have questions and make sure that I can get to them. So I will.
Okay. So first and foremost, I forgot to put in the chat, unless Mary, you did. So on this page is more information about the Public Health Initiative, as well as a donate link. So for anyone who's interested in doing that, if you want to direct your people that direction, that's where you find information. And we have lots of really good questions. So I'll do our best to abbreviate those in the time that we have left. So first question is, how are you going to measure that the Public Health Initiative is having a change of behavior or outcome for the widowed people?
That's a great question. And I'm going to say, I don't know. Not because we're not going to find out. So I want to just give you one small tidbit of why this is so difficult. So when we started working with the hospital, we were talking about how would we know if a widowed person received a newly widowed packet and what their response to it was. And so they started talking about where would they put that on the chart. So, you know, any of you who are familiar with taking care of people in a medical setting know there's charting. And so in the charting, it was like, well, where are we going to put that in the chart? Okay, well, there's no box for it. There's no checkbox for it. There's no opportunity to put it anywhere. Okay, how about if we put it in other? Okay, great, we'll put it in other. Can we run reports on other? Nobody knew if they could run reports on other. And if they could run a report on other, how would that spit out of the system? And then here's the other thing that was complicated and everything. Phil died at the hospital. On his medical record, of course, it shows his death. But on my medical record, it doesn't say anything. So nobody knows when I come back to the hospital with chest pain, thinking that there's something wrong with my heart for sure. And because, of course, I'm widowed, I'm in a panic because I'm feeling like my kids are going to be orphaned. And it was probably panic related to my grief, but nobody knows I'm grieving. And if they're not asking me the question, then I can just continue thinking that I'm having heart problems and people are continuing to tell me I'm fine, but I don't feel fine. What if instead someone were to ask the question about grief and then say, here's some resources to address that? Might my outcome be different? So how in the world are we going to measure that? I know that we have some really amazing experts in our widowed community. We will be creating a steering committee, and the steering committee will help us to answer some of those questions.
Excellent. Okay. So the next question is also a very good one. What does the training entail?
So early training at this point is twofold. So first, it's grief literacy from the language of grief. One thing we particularly focus on is language around suicide death. As many of you know, the common phrase is committed suicide. I don't know how many of you know that committed suicide came from the fact that it used to be a crime to take your life. And so when people say commit suicide, that's a habit that we are working very hard to break. And so those are just some, so we'll talk about grief language. We will talk about the widowed experience from a physical standpoint, an emotional standpoint, and a mental standpoint, so that people can begin to understand the enormity of the experience. So there will be a twofold grief literacy. One is just general. For example, perhaps don't say that, you know, your loved one's in a better place, and so that should make you feel much better. And again, that doesn't, I'm not just disparaging the fact that some people really do believe that their person is in a better place, but believing they're in a better place oftentimes does not soothe the immediate pain of separation. And so to be able to talk about that immediate pain of separation. So again, we have a collection of experts who are available to help us with this training. But the second piece of the training is very specific to Soaring Spirits, which is we want those responders, anybody who's being trained, to understand the programs so they know what they're sending them to. They're not just saying, oh, here, go do that thing. I heard that this is good. I think it should be fine for you. We want them to know that newly widowed people have access immediately to resources that are happening weekly. We want them to be really familiar with the newly widowed packet. When I did the training for the chaplains, I asked them to go through the newly widowed packet and choose their favorite thing from it. And then tell me why it was their favorite thing and how they intended to use it. So that when they open that packet, they're not just saying, here's some resources. Instead, they're saying, you know what, this document here for building your support network, it's designed to help you coalesce all of the people who offer you help. And if they'll write their name and phone number down on this piece of paper, then when you can't remember who told you that they were willing to help you fill in the blank, you get to see it right there. You can even put this up on your refrigerator. So I asked every one of them to choose their favorite thing. And when they offer the resource, to make sure they reference that. And so that's the kind of difference, I think, that the combination of grief literacy training, which we, like, as I said, have a plethora of options for how we will deliver that. Sometimes it will be in person, sometimes it will be virtual, sometimes it might be a combination of both, but then it's going to be paired with an orientation to our programs so that they're not just randomly sending people without understanding what they'll get, what benefit they'll offer.
Okay. So the next question is, are we looking at reducing vicarious and secondary trauma for those in helping professions due to having the training?
I think that's another question that we will be considering as we develop the training that we offer. because it's a great point. One of the things that we're really aware of is the fact that so many of the helping professions have been through the COVID years, right? They have witnessed trauma upon trauma upon trauma. They have had their own interactions with personally and professionally. And in addition to that, there's still the everyday work that needs to be done. And so we are going to be careful. We're going to be thoughtful, and we're going to be very strategic about how we offer this. But I want to highlight, like, one of the things that's most important, I think, is increasing their confidence in dealing with widowed people. Because the trouble is, right, many of them perhaps have they're married themselves or have a partner themselves. And every time someone experiences that one-on-one, right, they see themselves in that moment too. And so we want to be aware, we want to honor their humanity. We want to provide them with real and valuable resources that they can confidently share. And we want to help them to manage that trauma that comes from the repeated exposure to death and grief and pain. So yes, we are going to work on that. How will be developed by, I anticipate, again, we don't know the answers, but I anticipate we'll have multiple steering committees. I think we will have, some that are working specifically on training, some that are specifically working on who are the entities that we need in the room. There's just so many questions to answer, but I just want you to think, like, for a minute, how exciting would it be to be in that space of, like, okay, we have all of these people, all have professional expertise in these areas. We're working together to change the world for other widowed people. I can't wait for that. I'm super, super excited about steering committees.
Yes. Okay, so I think we have time for maybe one or two very quick questions. So the first I can actually answer. So someone's been asking about where can they find the survey we keep referencing. We will follow up with an email to everyone who RSVP'd tomorrow. So watch your inboxes for it. It'll be easy. It's just a Google form that you can fill out. So that is on its way. Maybe the final question for tonight, we'll see how we go, is I just want to say how much we appreciate all of the offers for help. I mean, we can just see them flooding in, being like, I have this expertise. I'm interested. I want to help. So I just want to say personally, thank you to all of those of you who have raised their hand already. And so we have one person in particular who is a nurse practitioner and very interested in helping us solve some of the electronic medical record charting system stuff. We use Epic at my hospital. So if you are at Epic, if you know about Epic or Orca for that matter, I want to talk to you. But they are really interested in creating an opportunity to screen for people who might be recently widowed. So as people are doing health screenings, to include, are you recently widowed? I mean, asking the question seems to be pretty simple. So they want to know, are we considering that within our initiative?
We definitely are. And I should have mentioned, one of the other outcomes that we expect to see is a decrease in urgent care visits for people who are widowed, with an increase in access to various modalities that will provide the support that you're actually not going to get in the hospital setting, right? So if I'm having anxiety and it's coming out as heart pain, going to the urgent care is not going to solve that anxiety for me, but the opportunity to have access to resource might. And so again, how in the world are we going to prove that, right? That's going to be the challenge. But yes, we really that's one of the reasons why we're focused on also training nurses. We're moving towards what it will look like for training for MDs also, but we're not there yet. But what we know for sure is that if we can provide the opportunity, just the quick question about whether you have a recent death in your family, and if the answer is yes, I do, being able to determine who that death was and then solve that one problem, right? Now it's in my chart. Now I have that in my chart. And being able then, next step though, is for them to be confident in their ability to deliver that resource. So I know we're at time, but I will just quickly say that one of the things at Adventist Health that recently happened was one of the nurses said she was doing her rounds. She came to the bedside of a woman who had been admitted for heart pain, and her daughter was next to her bed, and she said, we lost my dad recently, and since that time she's really been struggling. And so the nurse said, was so excited. I was so excited. Those are the words she said to me. I was so excited because I could run into my office. I got her a newly widowed packet. I was able to bring it out, explain it to her daughter, tell her that there were resources available to her. And she said she sighed like a breath of relief, like, oh, okay, there are resources for me. So not only is the widowed person served, right, but the nurse is served too. She feels great about being able to make that connection. So yes, we are definitely talking about that. It will be a part of the initiative. At what level and how is yet to be determined, but it's definitely on our radar. Any other quick ones, Angeline?
Nope, we are done with questions. So go ahead and close us out.
Well, you guys, I am so delighted by the response to this. I'm excited to work with the varying people from our community who have been so excited about how they can interact and what they can do. I'm grateful to our board of directors, our staff, our volunteers, everyone who makes the World of Soaring Spirits happen. Because here's the thing, without us, none of this happens, because we would be handing out resources to a place that isn't able to serve. But we know that we can, and we can because we're doing it together. So if you have the opportunity to support us with a pledge, raising that money is the first thing we have to do. That's just the reality of the world we live in. So the first thing we need to do is raise the money. We can do that through personal pledges, through those network access like we talked about. And then the second piece is the survey, as Angeline said, which will be coming to you by email. So please take a time to fill it out, certainly, but if you could get it back to us in a relatively quick turnaround, we really want to start using that information to drive this initiative, and especially to drive the funding. I want to show people why they should care about this and what we expect to do to make a difference in the world. So I also want to make sure, and if you are here tonight, then you are SVP'd, so you are already on the list. Two things will happen. You'll get the email, which we talked about, as well as the recording from tonight. So if you want to share the recording with someone, please feel free to do that. We just want you to know that it exists and that this is the effort that we're making. These are the things that we are planning to do. And the only way we can do it is together. But you know what? I believe that we can do anything together. We are an incredible community. I have heard people say more than, I can't even count how many times, how, wow, your community is really dedicated. Yes, they are, because we came together in these circumstances that changed our lives. And since that time, we've been changing each other's lives. So thank you for being dedicated, for being present, and for being here tonight. We know you'll have more questions, so please feel free to email them. And also you can write them in your survey as well. So thank you all so much. Good night, farewell. And we will have another town hall. So look for more information in a couple of months.